Good morning and welcome. This is the Cutting Out Stigma Men's Health Ambassador Barber Training that you've all signed up for. We're so happy to have you here. And my name is Ahonkhai. I am a physician. I used to work at Vanderbilt, still take care of patients. Ms. Sharon Hurd, who's going to introduce herself in a second too, who is the Executive Director and CEO of Streetworks. So I'm going to spend a couple of minutes just introducing you to why we're here. And then I'll pass it over to Ms. Sharon. And this is, here we go, because it's going to be a full day. So this is what I'm going to go through. Who are we? Who's the Cutting Out Stigma team? Why are we here? What do we want to accomplish? How will we do it? And a little bit of logistics. So we have a huge team. Oh, this is not showing up that well. We have a huge team that reflects some folks from Streetworks, from Mass General Hospital in Boston, from Vanderbilt, from the Harry, from Mojo Marketing, who you'll hear from a lot of places. All coming together. We are physicians, we're researchers, we're activists, we're advocates, all coming together to put this program together, and we'll talk to you a little more about why. Did anybody watch the little video that was part of the sign up? Okay, I'm going to show you this video. It's just 3 or 4 minutes, and this tells you some of why we're here. You'll see some familiar faces.
My name is Ahonkhai, and I'm an infectious diseases physician and researcher at Vanderbilt in Nashville, Tennessee. My research focuses on using innovative strategies to improve HIV care outcomes for people with HIV in marginalized communities across the globe. Tennessee is one of the states in the Deep South that is disproportionately impacted by HIV. Tennessee also has among the lowest rates of linkage to care in the country, and young Black men are the least likely to establish care after diagnosis. Through our academic and community partnership, we recruited a cohort of Black barbers to identify barriers and solutions to getting Black men into HIV care. Our conversations revealed some really important findings. First, HIV-related stigma remains a tremendous barrier to HIV care in the community, and that really needed to be addressed if any other interventions would be successful. Also, barbers were really eager to collaborate on the solution. They emphasized how they are uniquely positioned as trusted messengers to share information and help reframe the stigmatizing narrative against HIV. They described themselves as the doctors before the doctors and the counselors before the counselors. They also emphasized how barbershops are important canvases for sharing information in the community. But they told us that they needed a few things. They needed education and training about these topics, and information to share with their patrons in order for this to work. To work together on our proposal, Cutting Out Stigma, we will recruit and train a cohort of barbers in Nashville and Memphis to function as community health educators. These are the 2 highest HIV-burdened cities in Tennessee, and Memphis is an EHE priority jurisdiction. We will develop and launch a multimedia campaign to address HIV stigma in the Black community. This media campaign will include posters in the barbershops, billboards in their communities, short video spots to loop on screens in the barbershops, and video reels to share across the barbers' social media platforms. The media content will be informed by narratives shared by Black men living with HIV and Black barbers. Our goal is to reduce HIV-related community stigma. We have assembled the perfect team to do this. We have also collaborated with Mojo Marketing and PR, a Black-owned full-service marketing agency based in Tennessee, who has launched successful health campaigns targeting the Black community. In addition, we have investigators who are experienced in male engagement strategies and stigma interventions. We will share a short video produced by Mojo Marketing and PR featuring one of our barber investigators in his shop, reflecting on our initial conversations and highlighting the potential impact of this work.
What is HIV, and that's his partner, what's HIV for y'all?
I ain't gonna say that we don't think about it, and you know what I'm saying, it's just like, I don't know. They just new generation. I use condoms.
You a condom user?
Yeah, I use condoms. I
What
mean,
about
like,
you got kids.
Hey, you gotta put that on a t-shirt. I'm a condom
you know what I'm
user.
saying? I'm a condom user because I don't want no other kid.
I heard that.
I got one. That's all I need.
But it's only about kids. You don't think about HIV.
No,
Is that why
I
you
mean-
wearing the condom? No, I'm just saying. You just said because you don't want kids.
I
I
do
definitely
think-
feel you.
I
there.
do.
on
Just
that.
I
said
do.
it. That's what they thinking. That's
I
what they
think
using
about
it for.
kids more than I think about
I ain't
HIV.
studying the disease.
Right.
I don't want no kids.
But at the same time,
They don't even know about crabs good. You know what I'm saying?
We are really excited to launch Cutting Out Stigma and prepare to build on its success to target specific continuum of care outcomes for Black men in our region, especially linkage and engagement in care, along with other important health needs. Thanks for listening.
So you saw our very own Steve over there in his shop, distinguished gentleman. But these are not showing up really well. So you'll see numbers like this throughout. We all know, there's 13% of people in the United States are Black. But if we talk about HIV, if we talk about diabetes, if we talk about heart health, if we talk about mothers dying after childbirth, Black folks are always doing worse. It's the same for HIV. It's the same for every chronic disease. And it's not obviously because there's anything wrong specifically with Black people, but it's because of all of these structures and systems and the healthcare system failing us a lot of the time. And so this is why we're here, because this is where we need to galvanize our community to try and step in, because we shouldn't keep seeing numbers like this, whether it's HIV or diabetes or mental health or whatever it is. So we're here to work together to find ways to address these challenges, because it's for us. We need some of it to be by us and to be delivered by us. This is supposed to say that this is a pill, and so I hear all the time now, like HIV, I think it was KT, HIV is the boogeyman still in Tennessee and Nashville, in the South in particular. HIV now, you can take one pill once a day and live a normal life. That's where we are with HIV. It's not a death sentence, it's not the boogeyman. But for people who don't do that, yes, that may very well be what happens. But we're at a place now where this is a chronic disease. It's something that you live with. It's something you don't have to die from. And when I moved from, when I was in Nashville and I was taking care of patients at Vanderbilt, the first few times I was in the hospital taking care of people with HIV, it was people who were coming in late because of all kinds of reasons, but stigma was a huge one, and they were dying. They were coming in and going on hospice and dying, and they were Black men, all of them. And I was like, what's happening? This is something that's preventable. And people were dying because they were afraid, they were ashamed. And so I was like, this cannot be happening in this country at this time. So that's my motivation. That's why I'm here, that's why I do this. So I already told you HIV is not a death sentence. And if people don't get on treatment, if they don't take their medicine, 8 out of every 10 people will die. It takes time. They're not going to die right away, but they're going to die from HIV. But they don't have to. So that's why we're here. These are some of what I was hearing when we were having conversations in the community for this project about HIV. It's kind of just like a plague that you don't want to get near. Kind of like you're an abomination. This is like last month that we're hearing this. This is now. If I get HIV and it's positive, I'm out of here, like suicidal ideation type of thing. I mean, that's powerful, right? And this is why our community is dying more of this. This is the stigma. This is like the prejudice, the discrimination, the stigma. And this is why people are dealing with this in isolation and not dealing with it at all. So why you? I hope these work. Okay. So, all right, I mentioned I'm a doctor. If I'm lucky, I'll see my Black men in clinic maybe once a year, maybe twice a year, if I'm very lucky. The ones who don't mind coming to the doctor. But how often do you see your clients?
Once a week, once every 2 weeks.
Once every 2 weeks. So I think this suggests maybe twice a month. So you're seeing them even more than that. So that'll have the ability to impact people who are coming into the clinic, because not everybody's coming into the clinic. And if they are, they're only coming once or twice a year if I'm super lucky. But they're coming to you, right? That's the difference. So that's part of why you, because this is who you're seeing and I'm not seeing them. But why else? You are leaders. You're leaders in your communities. You're trusted. I'm sure you hear all kinds of things, because I know my stylist in the beauty salon. We share all kinds of things in the chair. We kind of sit there. It's a little bit of therapy. You hear all kinds of stories about people, so you're trusted. You know how to listen, and you're healers. And Steve's going to talk to you a little bit about that. But part of what you're doing in, like, you know, coming down, sitting in the chair, shake people up, you are healing people. So what do we want to accomplish? So this June is June is Men's Health Awareness Month. So it's good that we're here in June. What we want to do is partner with you to improve the health of Black men. And we're talking about HIV today, we're talking about mental health, we're talking about a few things. But we want to partner with you to improve men's mental health. And we're starting this conversation on HIV and stigma, but we're going to continue it from there. And so what is this going to look like? What is this program going to look like? I described it in the video. Today is focused on training you as men's health ambassadors. And we're going to add on to that the multimedia campaign, which you'll hear a little bit more about. And the goal of putting those things together is to decrease stigma and improve health. So that's a little bit of my introduction. I'll also add that today is a packed agenda. It's a full day. You have your binders there that have notes from each of the sessions. It has the agenda in there, and you'll see. Whenever you need, there's refreshments there you can go and grab. The restrooms are out this door here and to the right. So buckle up, get ready to learn a lot, engage. I will also say that after this, like what happens after this, so today we're focused on the training. But now we have your information. Ariana knows how to find everyone. But for those of you who are interested to take this ride with us, the next step is that we're going to partner with you on this social media campaign and get you involved in that. And we want you to have conversations. You're going to be able to have conversations with your clients. That's really it. It's really using all the skills and assets you already have to help us work on these challenges. And we'll provide you with some of the guidance to do that. That campaign is going to happen over 6 months. But the first step is to get through the training today and then say, okay, who's ready to take the ride? And then we'll go from there. Thank you so much.